Good afternoon. Welcome back. I am Dr. Gearing, and today we'll be discussing some questions that I've received regarding COVID 19 in general. I do appreciate all the comments and emails, and please keep them coming. I'm sure many of you are aware of the numbers. You can't go a day really without seeing them, either alerts on your phone or various news sources on TV. But there are more than 24 million cases of COVID 19 here in the United States, with approximately over 416 deaths. Unfortunately, this number is expected to increase over the next couple of months due to the many variants of COVID 19 we're seeing throughout the United States. And I will speak about those variants a little bit later on in the presentation today. Just wanted to give another big overview of the percentage of deaths across all age groups. And this is just looking at the deaths of approximately 228,000 individuals that have lost their life to COVID-19. We can see of those 228,000, well, a little bit over 61% were white non-Hispanic, followed by black non-Hispanic at 15.5%, and lastly the Hispanics at over 30,000 cases, 30,000 deaths out of the 228 deaths reported. Now, again, remember, this is only roughly half the deaths reported in the United States regarding the racial ethnic background. So these numbers may be a little bit skewed because there is definitely an increased proportion of blacks and Latinos or Hispanics that have died from COVID-19. So more data will be coming shortly. Many of you have asked me, are pediatric patients affected by it, or are they dying from COVID-19? The answer is yes, 100%. We do have multiple pediatric deaths, or many pediatric deaths, I should say, from COVID-19. Although, as you can see, with an increase in age, we do have an increase in percentage and obviously an increase in the number of deaths, with 85 years of age and older being the highest age, the most age group affected by COVID-19. But as you can see from this chart, we do have deaths in ages from birth to 4 years of age, as well as from 5 to 17 years of age. Now remember, there's 25 million people from ages 12 to 17, and another 255 million people over the age of 18. So we do obviously have more adults, and they are more severely affected by the number of deaths. But kids, children, pediatric patients are not excluded from deaths by coronavirus. I've been getting questions, does the vaccine even work? And many parents have compared it to the flu vaccine. I will tell you, this vaccine does work, at least in clinical trials. The efficacy of the Pfizer vaccine as well as the Moderna vaccine after the second dose, 2 weeks after the second dose, is approximately 94 to 95% effective. I know you may have seen some cases in the news regarding people that were immunized and still contracted COVID-19. Remember, even after that second dose, you are not fully protected. Give it another 2 weeks for that immunization to really be effective. So again, look at the data, look at those cases specifically, and looking at the timeline to see, did that person really have full immunity towards COVID-19? And remember, it's still 94 to 95%. Nothing is 100% regarding immunization. So even with full immunity, meaning 2 weeks after your second dose, there is a chance you could still contract COVID-19. It may not be as severe, but you can still contract it. Just keep that in mind. And if we compare really the COVID-19 vaccine to any other immunization that we receive in childhood or in adulthood, and I chose the MMR immunization, for example. MMR is one of our most effective immunizations that we do have. You have a 98% efficacy against measles, 88 against mumps, so actually less than the COVID-19 protection, and 97% against rubella. Now, if we compare our COVID-19 vaccine with the flu, the annual flu immunization, the flu shot is actually only 40 to 60% effective. So the COVID-19, in comparison to influenza, is much more effective than your yearly flu vaccine. This does not downplay the importance of receiving the yearly flu vaccine, and we'll talk about that a little later as well. This is hot off the press, meaning from early this morning. So Moderna did release a statement that its vaccine is effective against the British variant of coronavirus. However, and this is very important, the emerging concern in the United States is the variant in South Africa. We now know that the Moderna immunization, as well as the Pfizer immunization, your levels decrease as far as your antibodies levels significantly, and your protection from the South African variant decreases sixfold compared to the current variant and compared to the British variant. So what does this mean for us? Moderna has said they're already in the works of making a booster immunization for those that have received the 2-dose Moderna vaccine schedule to help prevent some of this resistance, I guess you can say, to the current immunization. Now, I would not be alarmed at this new information. We do know the coronavirus itself mutates an awful lot, similar to influenza. So I wouldn't be surprised if we see other emerging variants that we come across in the United States and in the world in general. In Brazil, for example, they do have another variant that many of those residents that had coronavirus earlier last year are now getting reinfected with a different variant. Probably one of the most concerning things that come out of this is that that plasma that we were giving the patients that contained antibodies was found to have no effect on the South African variant of coronavirus. So again, this leads me to believe we may need to be immunized yearly, similar to the flu vaccine, because of the different variants, of the different mutations the COVID-19 virus undergoes. So just keep that in mind, that again, we are not out the woodwork. These vaccines are not the end all, and that we are constantly refining and improving the immunizations. That South African variant, the B1351, because of this variant is concerning to the United States, travel from South Africa will be banned. And this is to curb, really, again, this variant to devastate the United States. We've already had devastation over the last year with over 400,000 people dying. And again, any way we can try to curb that number, and I'm in a full agreement with this. Many of you have asked me, so how well is the vaccine being studied? You know, it came out very quick. We have emergency use authorization. Is it really being studied diligently? And the answer to that is 100%. 37,000 participants, 77 candidate vaccine trials in over 47 countries and growing. There are currently 19 vaccine candidates in phase 3 trial and 8 vaccine authorized across several countries. You may hear the Johnson & Johnson immunization will probably be the next one to receive emergency use authorization. This is a one-dose regimen, which would be great if we can prove that it is just as effective as the Moderna and the Pfizer immunization with minimal adverse reactions and side effects. AstraZeneca also has a vaccine on the horizon, mostly in Europe. And also, there are currently some studies for pediatric patients. Pfizer has one with over 2,200 pediatric patients from ages 12 to 17. Hopefully, we'll get some data on that. Moderna had a little bit harder time enrolling pediatric patients. I think they were up to 800, needing about 3,000 for their study. So I will keep you updated on any new information regarding the immunizations in the pediatric population. People have asked me, I've gotten coronavirus, had a pretty significant infection. Am I protected? And how long does immunity from the immunization protect you? The answer to this question is we do not know. We do not know how long natural immunity might last, meaning you were infected last year. How long will those antibodies protect you? We do know those first 3 months after infection, you are protected with those antibodies. However, as time progresses, we do not know how long that immunity will last for. We do have some data on the immunization, meaning you do get at least, they're saying, a year of coverage. However, that may change with the different variants coming into the United States. One of the main questions I get is the vaccine safe? Short-term wise. I mentioned in one of the other presentations, majority of adverse reactions will occur within those first 60 days, with the majority of those occurring in the first 7 to 10 days after receiving the immunizations. We have a lot of data on those numbers, and it's very safe short term. Again, just the most common side effects are just pain at the injection site. There have been reported more adverse reactions getting that booster or that second dose. More systemic symptoms, malaise, you're a little tired, may have a low-grade fever. But again, that typically responds to Tylenol or ibuprofen and is very short-lived, not lasting more than 2 to 3 days. If you have received the second dose and have some side effects lasting longer than 2 to 3 days, meaning more than 7 to 10 days, I would contact your healthcare provider. Many questions have come about regarding cases at colleges and universities. And as I'm sure you've been reading or heard on the news, it's up to more than 400,000 cases among students and employees, and closer to 2,000 institutions have been reported over the course of this pandemic. We do have deaths. It's probably close to 100 now, most of them among employees and not college students. Many colleges have some hybridization, meaning some days their students are learning from the dorms and some days they're learning in person, especially those classes that require labs, for example, nursing or pre-med. But we are seeing this in many colleges and universities around the country. The colleges from my search that have come up, or I should say the states that have come up with the most cases affecting the universities and colleges has been Texas, Ohio, and Florida. New York also has the most schools affected, but not the most cases. But we are seeing this on college campuses across the country. Just want to mention a couple of things because I have received a number of questions regarding influenza. Again, don't forget it is flu season. Although COVID-19 has dominated the headlines over the last year, don't forget we're still seeing influenza. But this is a significantly low flu season, at least up until this point. The numbers are along the lines of the flu outbreak from 2010 to 2011, which was a rather low flu season for this time of the year. Now, why might that be? Well, a lot of the interventions we've been doing for COVID-19 will help also lessen the spread of influenza. Social distancing, wearing masks, not gathering in large places. These will also mitigate the spread of influenza, and they have. Last flu season, we had roughly 20 to 40,000 deaths reported. And as many of you may be aware, that number from COVID-19, we can have more deaths than that in 1 month. There were 169 million doses of flu vaccine given last year, and we have 188 million this year. So significantly increasing the number of doses. However, the influenza vaccination rates for African Americans and the Latinx population has decreased this year compared to last year. Perhaps, members of that community are a little bit more afraid of going into healthcare facilities to get the immunization with the number of COVID-19 deaths, especially affecting minority population. But please, African Americans, Latinx, everyone, do not downplay the importance of your influenza immunization. Again, imagine getting flu on top of COVID, on top of a pneumonia. So I cannot emphasize enough to my minority groups, please, please, please don't forget your yearly influenza immunization. If not this year, then next year. COVID-19 will still be around next fall, next winter. So please get out there and get immunized. Talk to your healthcare provider if you have questions specifically about influenza and if you catch COVID-19. But I can tell you, I would strongly recommend receiving the flu vaccine given these times with COVID-19 dominating the headlines. Vaccination rates show racial disparities. This is nothing new at all. We know that there is some historical significance of the distrust, especially among African Americans, with immunizations. But the numbers don't lie regarding deaths and how COVID-19 and influenza affects African Americans and Hispanics. The vaccination gap is most pronounced in non-Hispanic black children between the ages of 6 months and 17 years of age regarding influenza. I want to compare the different racial and ethnic backgrounds. 33% of black children received the flu vaccine this year, compared with over 40% last year. This year, we do have more than half of white children receiving the flu vaccine, and close to half of the Latinx children receiving the flu vaccine. Again, how can we explain these numbers? Is it access to, facilities? Is it vaccine hesitancy among minority groups? Remember, minorities are more likely to be hospitalized and die from influenza. Knowing all these numbers, if you know that there is a vaccine out there that can help prevent you from getting the flu, why not take it? I've taken mine every year for at least the last 25, 30 years. And I strongly recommend every individual in the United States that has no contraindication to receiving the flu vaccine receive the vaccine every year. Like the corona vaccine, it is a dead vaccine, meaning you will not get the flu from the flu vaccine. Now, if you go into the office and other individuals are sick, you may contract it from them, but not from the vaccine itself. Now, remember, as any vaccine, you will feel your immune system responding to the virus, meaning revving up, preparing in case you do come across the flu. During this time period, you may have some symptoms, but that's not of the flu virus itself. I can't emphasize that enough. Thank you all for tuning in today. As always, I can be contacted. Reach me via email, contact@gearingpediatrics.com. If you would like to make an appointment in New York State or Georgia, you can make one gearingpediatric.com, or you can visit my Facebook page. Thank you and enjoy the rest of your day.